My name is Jean-Marc Mbir. I'm a medical doctor, a general practitioner, working from Lusaka in a private institution, and here as a volunteer in HBB. HBB is a self-funded organization trying to reach the patient with hydrocephalus and SPINA BIFIDA in different areas of Zambia, especially where they do not have access to treatment, where they do not have enough neurosurgeons. The reason why I decided to join HBB, I joined HBB after hearing the challenges neuro patients were going through for them to access treatment, and especially knowing that their time they can be booked for surgery, but there is no possibility of them going for surgery just because of lack of shunt or because of lack of transport from one area to Lusaka. So I thought I could join the group and help these needy patients to access treatment.
I mean, what Help Beyond Borders is doing is very special because the doctors are basically helping children live a fulfilling life or live longer than they would have if they didn't get the help that they needed. And it's very inspiring to see that the doctors are actually taking time off and volunteering to help and not expecting anything in return. This is the first outreach I've been on, and it's been very fulfilling as well as overwhelming.
We arrived here on Wednesday. Just from Wednesday, the team was called that there are some patients who are waiting for us at Livingston Central Hospital. Where some patient, the neuro patient, of course, the doctors and another team went to there and get some samples, of course, CSF and some blood to be learned so that we see if all the parameters for the results are okay and those patients to be shunted on.
So we are here in Livingston for our outreach. We've had a very interesting day. We've seen a total number of 12 babies and a number of mothers who had also come for training, and one 18-year-old girl with a myelomenincocele on the spine, which she's had from birth. Then the other patient we saw was an adult with a brain tumor, and another adult who also has a cervical spine problem, which we are yet to investigate. So the one has been interesting. The turnout hasn't been so good, considering we actually were unable to really reach out to the villages, and the communication actually wasn't very good. But we're expecting more people to come tomorrow because most of them gave an excuse to say they're coming from very far away villages and they were unable to make it on time today. The one thing that really caught my attention was a baby who has hydrocephalus. It's congenital hydrocephalus, not yet investigated, but also has very proptosed eyes. So that baby, unfortunately, the parents felt that they did not want surgery.
Pena badwe mwana sanalile ko sanalile sanashite vivonse. But condition yake mwana badwe sana badwe manga bana bonse mami balili I different na bana babe nangu vana badwa mutu suri mushe at menso sali mushe manja sali bwino then peti nameta kuno hospital nakambatira problem ya ati mabonzo mutu sali bwino. So afuni komishta operate na veins sali bwino, so afuni komishta operate kuti mabonzo aja mwana gafa ke baka fake budo mutu kuti ankale bwino.
Zinanga ndineketi nchapewa mwana mina dwala ni muzukuru wanga. So kudwala kwa mina dwala mwana nabadwa so chabe chokache mkubadwa kwake ali so chabe situation mami mamuonera. So pe anabadwa pajina manja sayo nduluka mushemushe banabwa bamuleta pape baona vilema kwa mene kujeno kutika pena ni kesi manja bazaisa papeza kuti manja aja mulibe majoin muja mulibe ali so chabe mabonzo. Meisho konka hapo futi mkupima mimi nakamba kutia mabonzo mwana niogwirana afunika kwenda kashita separate so separate tandizo ifunika kuchani kuTH so manje amaye lake pomvera so nabo banabwera ba like banakana kutia manje bakaenda kashita mabonzo ashite separate ndiye pa zankala buno ati mwana menso aja kutia bwerere sibana vivomeli si mutima so okondwera kupeza kuti mwana aliso but ndifaka chivyo manja mulungu.
The one thing that I noted after having a serious talk with the mother is that actually she did not understand the condition of the child and the type of surgery that the child needed.
From our assessment, she was misinformed by the community, we believe neighbors and other people, on the procedure because she believed the baby would die if the baby undergoes that procedure. So we managed to speak to her and also managed to speak to the husband who wasn't present at that time, but we managed to get in touch with him and the mother-in-law.
She had lost all hope. She had been admitted in the hospital for 2 weeks. Her child wasn't attended to. And I think she's one of them who's going to be transferred to Lusaka. So just to see like her going from being so defeated and hopeless to smiling and just to see how things turned around for her. Yeah.
After we spoke to the husband and the mother-in-law, we managed to convince them and give them more information so that they can make an informed decision in coming to UTH for the baby to be attended to by senior surgeons at UTH.
It was interesting to know, to get to know the many reasons that mothers and fathers shun away from the idea of their baby seeking help for hydrocephalus surgery, that is. So that was the interesting part for me because we had to counsel different mothers, people that just did not have enough information, and after talking to them, after giving them the information, the psychological therapy and help, it was really fulfilling to see somebody content with the information that you've given them. So moving forward, I think the sensitization part about the conditions that are encompassed in Health Beyond Borders and the treatment options, which is surgery in this case, I feel we should dwell more on that because people are willing, if we manage to convince those mothers, I feel people are willing to be part of the treatment or to consent for the treatment for their children, but they just do not have enough information.
For hydrocephalus and spina bifida, just like any other congenital problems in these babies that we see, there are a lot of factors that attribute to the same. And one of the things that we have noted in most of the mothers to these children is that most of them are very young. So usually what we feel is a contributing factor when it comes to age of the mother. Most of these are mothers who are young, other than being in the villages. These are mothers who don't want to go to the hospital on time when they are pregnant. So it's an issue of they're trying to hide the pregnancy. So you find even when they might know very early that they are pregnant, but they will not take the folic acid, they will not take the supplements that they need to take simply because they're probably scared that people will find out they're pregnant. Others, it's just the stigma that people will laugh at them, they are pregnant at a young age, so they would rather just be in the house, and they'll have these children who are lacking in a lot of things, children with hydrocephalus, children with spina bifida, simply because of that. And we have noted even the patients that we are receiving at UTH, the mothers' ages usually range from the age of 14. We have mothers as young as 14 years up to somewhere 20 years. Usually those are the age groups that we are seeing.
Sena mwali bambila gunka. Sena mwali bamba gunka.
As part of this outreach, there's a patient of interest that we saw today. His name is Audric. So this is a patient with shunted hydrocephalus. This is a patient with hydrocephalus, basically water in the brain. You know, we all have water in the brain, which helps to nourish and to support the brain. But then when that water is being produced in excess, then it causes a problem. So this condition is called hydrocephalus. So that is the condition that he has. So Audric was shunted, meaning that we put a tube to divert that water from the brain to the tummy, and then from the tummy it circulates through the body. So basically that is one of the methods of intervention that we put in place as the neurosurgical team. So it is called a ventricular peritoneal shunt. So Audric presented to Beit Cure at 3 months old with hydrocephalus, meaning that the water was accumulating, the head was getting bigger. And so the intervention at that particular point is that they pushed in a shunt to divert that water. So the shunt has been working very well. He has not had any challenges. He's not had any significant difficulties, only for his convulsions. He's been fitting from time to time, so he's already on medication to take medication to prevent the fitting. So basically that is what has been happening with regards to him.
Bewo zina lyangu ndime Victor Nyemba. Ndikhala mu Zimba district kuruyaba village Jigambo. Ndijisi mwana izina lyagwe ngu Audric ya Zero Nyemba. Uyu mwana banyina baga minta mani akakwana 9 months. Ponya taena akatumbukirwa ku clinic pe. Wakatumbukirwa nganda. Nuni waginda just 3 days wakatalika kuyuma. Naga kuyuma twakasola kumusirisha mu chintu chisiya. Katuyera ku sometimes cha mutwe. But jagaga ndakamweta ku Zimba hospital. Ku Zimba bagamba kuti a problem twamujaneyo chitaku kurusaga ku betikiwa nkoba konse yagiyo isofa. Then ndaginka kurusaga kuya bakumubika ka shanti mu mutwe. Ponya kuyuma kwakali kuyuma kuya wakarega. Noni waginda almost 7 years so. Futu azotalika kuyuma. Pani ngandali kumutola kurusaga ku review ngala joka kurusaga every after 1 year ndiramutola ku review kurusaga. Ponya kuzwao ndakadabora limwe kuno ku Livingstone ku review nkundalijana chino chindiko ndipede. But ichigoro uraiya mu grade 5.
So in the sense of development, he's been developing normally. He's just like any normal child, except maybe a few minor difficulties that he's been experiencing. As we discussed also with the father, and as we are well aware due to our follow-ups, he's currently in grade 5. He goes to school, and he's able to walk, feed himself. You can talk to him. So basically, he's just like any other normal child. Though he has a few challenges of his own. So the reason why I'm sharing this story is because we have a lot of mothers out there in the outskirts who have children that have hydrocephalus. And sometimes this hydrocephalus in the communities is looked at as something that is supernatural, something that has been inflicted on a child, maybe due to witchcraft or some sort. And these are children that are hidden from the society. These are children that are kept in the houses, and by the time that they present to the hospital, you find that that chronic pressure on the brain has led to significant damage to the brain, and these are children who end up being in a debilitative form, like maybe having challenges to walk or cognitive or brain function. So in a nutshell, like we mentioned in the case of Audric, he was shunted at the age of 3 months, so that's early. So the earlier the intervention, the better the outcome. You know, when we shunt, when we intervene early, the outcome is usually better. And so as Help Beyond Borders and as Zambia Medical Association, our plea to the community out there, both to the health caregivers, the community health workers, and also the people in the community, the leadership, the mothers, the parents, that when they have such a child who has a big head, it's not the end of it all.
Shondi kurwaizi yabiyo alimwi, kurindi suno tujianda kuziara. Bamaga intu jasika jindi ja kuinka ku clinic. Katuba kurwaizi ya kuinka kujipimo. arimwe gabachirizi yamarayirire ngo babapa mo especially kukunywa tuyatuma folic acid eji yajipa kuti ibana bari mwiddaga batajja nima problems aziyarwa twakubora mbuli kumwana oyo Odrick ngwa number 3 tagwendera muyandabe amba mbuli bana mbendi kisibali 4 babenzi nyina kamba utulabereka nchito ndiramutuma kungombe ndiramutuma kusanina nkugu milimo yonse ibereka benzi nyina urayibereka alimwe akuchikolo rayinka kabotu so ndimubikideo mba mbuli bana benzi nyina bonse.
In the rural areas, there's a lot of teenage mothers who have children with spina bifida, and they are unaware. They are shunned by the community, and these mothers hide their babies, in their homes. Even when there's when people go out to speak to them, to sensitize them about the disease or what is going on, they are scared to come out because some of them feel like they are cursed. And with some of the stories, you find this mother has maybe 2 or 3 children with the same condition just because they were not in a place where they could just get simple folic acid.
We had 3 operations. We did one on a Thursday. We couldn't do it early in the morning because theater space and everything, so we opted to do it in the afternoon. Then we couldn't do it around 11 because the children had to starve and everything like that. On a Thursday, we did that's Ethel, if I remember very well. Ethel was the first patient we saw. I was the one involved in anesthetizing the baby, putting the baby to sleep, to make sure the baby doesn't feel pain, to make sure the baby has a good sleep. We had a smooth ride. The baby woke up well. We had no difficulties. Everything was smooth. The baby wasn't in pain. The baby woke up with a nice good cry, and the baby is now doing fine. Then yesterday, on a Friday, we did 2 in the morning. Both of them we did under general anesthesia. Both of the babies woke up well. The GCS of 15, saturating at 100 of O2. They're in the ward, post-ops, they're doing fine.
My experience in theater, I really felt really bad when I saw what the babies go through when they're just about to put the shunt. I feel it's a lot of work and they experience a lot of pain. There was this specific baby, Ruth. So we had to counsel the mother, we had to talk to the mother, and after talking to the mother, and specifically I remember Dr. Miti brought in another child who had hydrocephalus and was about 13 years, 11 years. Yeah, and to give as an example that even if you have hydrocephalus, even if your child has hydrocephalus, they are able to live a long life and a normal life. So at least that gave her a morale, and to see that even their babies can live. From there, that's when she also accepted that the baby can be operated on.
So this is baby Ethel Kaole. This is a female 6 months old. We operated on her yesterday. We did the shunt. This is a baby who had post-infectious hydrocephalus. The baby is doing well, except the mother has reported some vomiting, though we are mostly attributing it to the fact that the baby was being breastfed while lying down. Otherwise, the baby is stable, there are no convulsions, no fevers, and the baby is breastfeeding well. Okay, so tomorrow will be our day 3 in Livingstone, and we plan to go to Mukuni District Clinic. Ideally, we were planning to go there today, but unfortunately, they did not manage to mobilize as many patients. So we've actually advised them to just let the patient come tomorrow morning. So tomorrow morning, we're going to see both the patients and the mothers. And also on the mother's part, we want to emphasize on preventive measures because we believe prevention is better than cure. So we want to emphasize more on the use of folic acid in all childbearing age mothers so that we can try and see how we can reduce this burden of hydrocephalus and spina bifida.
We had a bit of challenges with our clinic. I think that's because of communication. Maybe we did not communicate with the district a bit early for them to book a good number of patients for us. Like right now, we're at Mukuni Clinic where we only had, I think, about 5 or 6 patients. And that is just because the community was not really aware about the program.
I'd urge people at large to join Help Beyond Borders because, you know, people in the community, you know, the government can't manage to do all these things. We need to supplement them. And it's not everyone that gets to know the knowledge about what's happening around. And these people in the community have less knowledge about what's happening. So I dedicated myself to helping these people, making sure they get good care, they don't shy out, just making sure they have a normal life, at least giving them something that they don't get on a daily basis.
We've had a very interesting time here in Livingstone with the patients, with the mothers, and some of the things that really captured my attention is just the levels of ignorance when it comes to the conditions such as hydrocephalus and spina bifida, and also the management that follows thereafter. We actually had a lot of challenges trying to talk to the mothers concerning these conditions, and I personally feel instead of a lot of talk on how to treat these conditions, I feel we need to do more of preventive measures. So I think we need more sensitization, more talks to these mothers to see how we can help them. 1, to understand more about these conditions, and 2, just to see how we can prevent them. So during the outreach, we saw a number of patients with neurosurgical conditions, and we saw how depressing it is for these mothers to these babies who have these conditions. It's a situation where they don't understand the condition, and then they have this baby who seems to have a big head, and they are kind of judging themselves first before feeling stigmatized by the community. So it's not an easy situation, and even the mothers who are already admitted in the hospital, they are in the hospital, but they don't know exactly what is expected of the child that they have. They don't know exactly what kind of help can be offered to them. So we actually had a lot of difficulties convincing some of the mothers to allow us to operate on their babies, because some of them were told by people in the community to say, no, the way this child is, the only thing they're waiting for was for the child to die. Like they didn't know there was hope for these children. So we took a lot of time trying to explain to them the possible outcomes of these babies after the operations. And luckily, we had some elderly children who had come through for review. And these were children who had hydrocephalus from birth. and some of them had been operated on, and they've grown up like normal children. So I think that's the one thing that made it easy for us to try and talk to them and convince them. After they saw the other big children, they saw that there was kind of hope, and after we explained, they kind of understood more about the condition.